Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. Skin reduction surgery, which I call a Benelli type mastopexy, is used to remove excess skin, sometimes as part of the main procedure for gynaecomastia, more commonly as part of a staged procedure as a final tidy up. This gets rid of excess or loose skin on the chest area that may be left behind after removal of the fat or gland tissue from a previous procedure. It's most commonly used in those with larger breasts or elderly gentlemen who have loose skin. The procedure involves removing a donut of skin around the nipple and suturing the outer edge to the inner edge, tightening up the skin and flattening the contour of the chest. It can be done under a local or general anaesthetic and is generally a day case procedure. A strong permanent suture is used to maintain the diameter of the nipple. Dissolving sutures are used on the skin, and shower-proof dressings are worn for a week after surgery. The scar goes all the way around the nipple. The scar will be red to begin with, may go through a phase of being lumpy, and this red and lumpiness may last for anything up to 18 to 24 months. There is a risk a keloid scar may form. This is a growing scar and a difficult, hard to treat problem that may require referral elsewhere. The scar may stretch. This is not uncommon and may require further scar revision procedures. After the procedure, there'll be puckered skin around the area. This is quite normal and it usually settles within the first couple of weeks. Sometimes it takes a little longer. Afterwards the nipple might be a little bit puffy or numb. These usually resolve within a few weeks as well. The nipples will not be perfectly round. Male nipples generally aren't. Expect differences in nipple shape between the two sides. It's impossible to get them looking exactly the same. After surgery there may be changes in nipple sensitivity or erectile function. Whether the nipple comes in and out or the sensation is not governed by any specific nerve that we can identify and protect. So in spite of our best efforts, these may change. There's nothing we can do about this, and there's no surgical procedure or medicine to take to restore that. Complications associated with this include infection, which is in the region of 2 to 5%. It's usually treated with oral antibiotics. It would be very rare for it to require anything more than that. Bleeding following surgery may occur, including hematoma formation. The risk of return to theatre is very low. There is a risk of damage to the blood supply of the nipple and nipple loss, which may manifest as blistering or scabbing of the nipple. This could require further surgery or dressings for a long period of time. This is thankfully incredibly rare. All the complications associated with this are generally very rare. More commonly, patients complain of aesthetic issues such as overcorrection, the nipple's made too small, undercorrection, it's not small enough, the shape of the nipple which will not be perfectly round. They may be unhappy with a technically good result, which is why I spend as much time trying to understand your expectations before the surgery. Or you might be unhappy with it at certain angles or when you look at it in the mirror in a certain way. This is quite normal. Surgery cannot make you look perfect at every angle all the time. After surgery you'll have a shower-proof dressing that can be removed at a week. Thereafter you shouldn't require dressings. You'll normally be seen in the clinic for a follow-up at this point by the nurse. If you're interested in seeing the surgery, have a look at the video I've made for trainee surgeons on ibreastbook.com. Just go to the Gynaecomastia section.